My first English class was also very interesting. That was actually my first class in school in Dublin, Ireland. And they placed me in the classes according to my grades. But little did they know that the kind of English that I learned in Malaysia is communication level English. It is English like, how do you go to the market to buy some vegetables, or how do you ask for directions? And when I started my school in Ireland, they placed me in honors English, which is all high-level English literature. So it was very, very nice because I enjoyed that very much, and it was one of my favorite classes. In fact, the English teacher was my favorite teacher in high school in Ireland, and her name is Anne Gormley. So my first class in Dublin, Ireland was English class, where they were halfway into doing Hamlet. And I had never heard of Shakespeare or Hamlet in my life before. And when I came into class, I was late because it was my first day in school in January. And I sat in the corner, right in the front of class. And when she asked me to start reading Hamlet, you know, I just borrowed the book from my friend at the side of me and started reading. And, you know, the whole class just could not stop laughing. I didn't know where to start or end. I never heard of Shakespeare, and here I was reading Hamlet. So it was interesting.
And you were in Ireland for how long?
12 years.
And you did your medical school there?
Yes.
And then after Ireland?
After Ireland, after medical school, I did about a year and a half of residency there, which was also very formative. I enjoyed it tremendously there. And it provided the groundwork and foundation for my medical practice as well as my work ethic till today. I then moved to Massachusetts and did my internal medicine training at the western campus of Tufts University in Springfield, Massachusetts. Mm-hmm. And that was also very formative and enjoyable. And I took up golf during that time. So that was cool.
Are you a good golfer?
I'm not very good because I do not have enough time to play golf, and I took up golf so late. Mm-hmm. When I watch the young kids swing the golf club, it is so natural. And till today, I have a very unnatural golf swing, but I try to make it true.
After Tufts?
After Tufts University, I went to Nashville and embarked on my cardiology training as well as my clinical cardiac electrophysiology training. So I was in Nashville for 7 years.
What is a clinical cardiac electrophysiologist?
So that is a subspecialty of cardiology. Not only do I practice general cardiology, which specializes in heart health, but I also specialize in abnormal heart rhythms that affect the heart. So I would deal with patients with slow heart rhythms, no heart rhythms, or fast heart rhythms, mm-hmm. whether they come from the top chamber of the heart or the bottom chamber of the heart. So not only do I perform ablations, which we use catheters to cauterize or eliminate circuits, abnormal circuits in the heart, but I also implant pacemakers and defibrillators.
Wow, and that's, how many years of extra training is that?
It took me an additional year in Vanderbilt
mm-hmm.
To train in clinical cardiac electrophysiology.
And where did you go after Vanderbilt?
I then took up a position at the University of Colorado as an assistant professor in clinical cardiac electrophysiology. And I was in Denver for 3 years and thoroughly enjoyed my time there. I love the weather in Denver. I love the arid climate and the high desert climate.
Nice. And then you ended up?
I then finally came to Albuquerque.
Uh-huh.
I found a job opportunity here and chose Albuquerque based on the climate that was similar to Denver, only with a lot less snow, although you would not know from the recent weather here.